whenever you're ready.
So imagine yourself sitting in a classroom setting or a lecture, and you're trying to pay attention to what your teacher is saying, but you manage to look at the clock 5 times in a minute, you check your phone 3 times, and you can't find yourself being able to sit still. Well, if any of this sounds familiar, you might have ADHD. And it's very common to have ADHD, and 3 to 5% of children in ADHD cases found. I'm going to talk about 3 main parts of ADHD: the symptoms of ADHD, the cause, and finally the treatment for ADHD. I'm going to start off with the symptoms, and I'm going to start with inattention. They're easily distracted, and it does not appear that they listen while others are speaking. It's very hard for them to comprehend most of the time while others are speaking, and even whenever they're just reading a book by themselves. They often daydream while they're sitting in class, and they forget daytime activities, and they often lose personal belongings. Hyperactivity is they cannot stay seated for a long period of time, and they often can't really let go without moving or doing weird things with their hands or stuff like that. They talk excessively whenever they're around others, and they have a really hard time playing quietly with other kids. The next one is impulsivity. They have difficulty waiting his or her turn, and they have no patience. They have a hard time thinking before they make their decisions. They often make really poor decisions. They often interrupt people while they're speaking. And I got those 3 facts off of kidshelp.com. Secondly, I'm going to talk about the causes of ADHD. But the cause of ADHD is very different case to case. So I'm going to talk about heredity and genetics. ADHD is often found in the family, from like a mom, a dad, a grandma, or a grandpa. Children with ADHD often have lower levels of dopamine in the brain, or they also can have a gene causing them to have thinner tissue in the brain where attention is found, according to WebMD. The environment where a kid is brought up in, research currently are investigating the frontal lobes of the brain concerning problem-solving impulsiveness, trying to find how many differences there is between kids with ADHD and kids without ADHD. Children with ADHD have lower levels of white matter in the brain, and white matter is the long-distance connections in the brain. All right, moving on to my third point, I'm going to talk about the treatment for ADHD. Medicine for ADHD, there is a stimulant drug out there called Adderall, and most of you guys know what that is. We're in college now. And according to Webster.com, it is an amphetamine that stimulates the brain and keeps it focused while doing tasks and sitting in boring classes. Another drug that is also commonly used to treat ADHD is Strattera. And according to whystrattera.com, it boosts the levels of norepinephrine in the brain, and I guess that just boosts activity or whatever. Therapy for ADHD is another treatment option. Cognitive and behavioral therapy are the most common ones that people use, and sometimes simply just using a pocket planner or even just a life coach helps them out a lot. But before you treat ADHD, you have to diagnose it. You have to test the subject with other kids that don't have ADHD and compare them. You also have to test them with many types of tests to determine if they have ADHD. Then you look at the symptoms that I previously listed. Okay. In conclusion, ADHD is a very serious disorder in kids and adults. When you know the symptoms and causes and treatment, maybe you can get tested and see if you have it.